Hello, my friends. Andrew Kornfeld here, reporting to you from Ocean Beach, Sunset Cliffs, San Diego, California. It's a beautiful Sunday afternoon. I assume you'll probably see this video on Monday or maybe on Tuesday. And in today's video, I want to address a question that I've been getting recently now that we've come out with our new website. In many respects that you haven't heard from me quite as much over the last 2.5 years as you did in the 2.5 years prior. And that question is, why did you stop doing IBD Coach and why did you start Systema Health? And I think that is a beautiful question, and it's a question that I want to fully address right now. And it's both for personal and professional reasons, and it's been both a professional and personal journey. There's been a lot of ups, there's been a lot of downs, and I think before I even start, I want to address that I wouldn't be here without the countless incredible human beings who have helped us to get to this point. There's been many dozens of people, and probably about 12 especially, that have worked extremely hard on IBD Coach and even the prerequisites to IBD Coach to really prove out this model and show what is possible and how profound healing from chronic illness can occur even in the face of extraordinary adversity. We started IBD Coach shortly after I dropped out of medical school and left medicine in 2019. It was one of the toughest decisions of my life, and I hesitate to even say drop out. But I knew that I could probably have a larger impact in healthcare and health if I didn't spend the next 8-12 years of my life pursuing medicine. And rather than me becoming the doctor, and this took, some level of, allowing my ego to come down a few notches, because I've always wanted to be a physician. I come from a very medical family. My dad is a physician. My mom is a nurse practitioner. I said, what if we actually started to work on the healthcare system itself and started to kind of reconceptualize it, and we started to organize doctors and, most importantly, organize patients. And given my own journey and expertise with inflammatory bowel disease, upon the urging of several incredible people, I decided to pursue my career in the field of IBD. And the field of health coaching was not brand new, but it was just starting to emerge. And there wasn't really a field of condition-specific health coaching. And in many ways, IBD Coach completely defined that field, and we certainly defined the field of IBD coaching. And now you search the internet, and we were the first, and there's plenty of people doing coaching in IBD. That's not to say there weren't practitioners working in the field of IBD that were not just gastroenterologists and other members of mainstream medicine, but we were really the first to put out a serious program with condition-specific coaching in late 2018, early 2019. And we said, what if we take IBD patients, take people with Crohn's disease and ulcerative colitis and microscopic colitis and indeterminate colitis, which are the 4 types of IBD, and we put them in an environment that would allow them to be superhuman, that would allow them to learn everything about their chronic health condition, to learn about the latest research, to learn about the biological mechanisms to actually understand how their chronic health condition would work, does work, understand the latest medications, which ones have different safety differences, understand all the dietary strategies that are out there and how to actually form their own dietary strategy based on science and evidence, how to look at the latest supplements and herbs, and which ones are BS and which ones actually have scientific evidence and which ones have more scientific evidence than others, and then to actually put those into a model, in a systems-based model, and see which ones are working for the individual patient, the human at the center. And then for us not to isolate any members of the healthcare team, for us to embrace GI doctors, colon rectal surgeons, primary care doctors, functional doctors, naturopathic doctors, health coaches, nutritionists, dietitians, therapists, the whole 9 yards. And for us to not take sides, but then to integrate these things together. And you could say that I didn't know if this approach would work. I had a hunch because it worked for me. But I think that historically the healthcare system has underestimated the power of the patient, has underestimated the power of the human being at the center of all of this. And we capitalized on that. And it was soon very clear that something special was happening. We saw inflammatory markers go down. We saw people that had been struggling for years. Often people who tried every medication, who were trying every diet under the sun. Some people had tried 20 or 30 different supplements and herbs. And we said, okay, let's hold on 1 second and let's start with you. Let's help you to change your mindset around this entire process. And again, for you to learn everything there is to know and then give you a framework for you to design your own protocol and then implement that protocol in deep collaboration with your diverse medical and health team. And this experiment of IBD Coach was a wild success. And dozens of people came through the program. I think over 235 people came into the program specifically. We touched thousands more. I had well over 1,500 conversations with IBDers. I really took the time to understand this condition. And like I said, we saw some pretty profound results. I have a confession to make. I knew from the very beginning that I wanted to prove this systems-based model in IBD and then to apply it to other chronic health conditions and, for that matter, to healthy human beings in general. And I knew, as I was talking to my co-founder, Alex Yao, at the time, that IBD Coach was just the beginning. But we had to show that we could do this in a more controlled format. And that's why we did it with IBD. I went through a lot of different things in my life. I had a change of relationship from someone who was the love of my life and also made extraordinary contributions to IBD Coach, and we wouldn't be here without her. I traveled internationally, really, for the first time in my life. You know, it wasn't the first time, but it was really the first time that I had experienced a full another culture, and I moved to Mexico City. to kind of process this big change in my life. And something wasn't feeling fully right for me with IBD Coach. The universe was giving me signals that it was time to move on. And a few months prior, I had crystallized the vision for Systema in an incredible place while we were celebrating Alex Yao's birthday in Mexico. And we had discovered this incredible hot spring river. And I was by myself sitting in this hot spring river. And I imagined the vision for Systema Health, of how we could take this model that we had established with IBD and to apply it to everyone. And especially people with IBD who had comorbid health conditions, which I would say we struggled with the most with IBD Coach because we learned IBD in and out. But when someone had another chronic health condition, 3 other chronic health conditions, we weren't expertise in that area. It was a beautiful moment. I started to imagine what Systema could be like, what my life could be like. And a deep process of healing for me started to occur. Little did I know that the path ahead would not be as linear as one might hope. But like life and the universe it was very beautiful and nonlinear. In early 2023, in springtime of 2023, 2 years ago, 24 months ago, there was a point where I knew it was time to move on from IBD Coach. And that moment happened when I was walking up a beautiful mountain with my Savannah cat, Tortuga. We call her Choya now because a Choya cactus is very prickly, very clingy, very beautiful, and she's all those things. And it was the first time she'd really hiked on a leash before, but she was sitting on my shoulder and we were hiking up the mountain in Joshua Tree, right outside the park. You can't take animals too far off the trails or off the main road in national parks, so we were right outside the national park. And it was springtime, right around this time. It was late March. And she started to meow. And she jumped off my shoulder and we ran up this mountain together. And when I got to the top, I thought about all of the people that had helped me get here. And I was overcome with gratitude. Not only all the people that had worked on Systema, as I said, but all the members that had come through, the people who had put trust in us. But I knew it was time to make a move. And I began the process of shutting down IBD Coach. I knew that I needed to take some time for myself. A little bit of time before I jumped into this journey of what I view is going to be probably nonlinear, of massive change that we are about to see in our healthcare system. And Systema is going to be a part of that change. About 14 months ago, after we had fully transitioned IBD Coach, I was doing some personal coaching, at the time working with IBD patients, but also starting to work with people with other chronic health conditions. And I started to see that I was able to apply this model of IBD to other chronic health conditions successfully. And in January of 2024, we started working intensively on Systema Health. And I thought that I would need about 4 months of time to really get it off the ground and actually to maybe hit the point where we are now, maybe a little bit behind where we are now. Well, as it goes, things take a little longer sometimes. And rather than give you something that's half-baked or half thought out, we've built something and given you something that is fully thought out. And we are ready. As one of my mentors tells me, if you have a deadline, multiply it by pi, 3.14, and that's your actual deadline. So here we are now. We soft launched Systema Health in September, and we were able to launch our foundational accessible program called Systema Core, which is now currently free. It won't be free forever, but I would encourage you to join Systema Core. We put a lot of thought into what that curriculum could look like. And we are here now where we have fully launched all of our programs through Systema Health currently right now, and we have more in the works as well. We have Systema Core, we have Systema IBD, and we have Systema One-on-One. Systema Core is again our accessible program for all chronic health conditions, including IBD. Systema IBD is our specialized program for people with inflammatory bowel disease. That is a refinement, to say the least, on IBD Coach. And Systema One-on-One, which is an intensive three-month coaching model where we apply our modality that we now have a name for, systems-based health coaching, to conditions besides IBD. Pretty much all chronic health conditions. Okay? What an honor to be here. So to answer your question, why did I transition IBD Coach to Systema Health? It's number one, so we could help more people, and we could better help IBDers with other chronic health conditions besides IBD. And number three, so we could make the maximum impact on the healthcare system. And that is what Systema is going to allow us to do, and that is what we are doing. I kind of want to end this video with a message for some of you who have dreams. Some of you have dreams to heal and recover. You don't even have time to think about anything that's a little bit higher on Maslow's hierarchy of needs. And I first want to say that if you're struggling right now and you're sick, maybe you're running to the bathroom, maybe you're extremely fatigued, maybe you're in pain, maybe you're having other symptoms. Maybe you've been diagnosed with a chronic health condition that you never imagined you'd be diagnosed with. Your body has a profound ability to heal. Just like your brain is plastic, okay? And can change, your body can change as well. And you have to cultivate that protocol. And you have to not give in or give up. And the same thing is true for entrepreneurship. And for those of you who have a dream of starting something or building something or making something in this world that betters humanity. The only way you lose at healing or at building something or building your dreams is to give up. So do not give up or give in. And there are so many times And I know so many of you can relate to this. I know people right now who are in the fight of their life right now, trying to just survive, trying to heal, trying to see a better day, trying to reduce that inflammation in their body. There are so many times when you are going to want to give up, and there are so many times where I've wanted to give up and just throw in the towel. And that's the only way you fail, is to give up. So don't do it. Keep going. And we want to be here to support you in any way we can. We are working as hard as we can to make Systema as accessible as possible to as many people as possible, to those with a wide swath of chronic health conditions all over the world from a diverse set of socioeconomic backgrounds. Everyone deserves to heal and be healthy in this world. And that is what we believe. And we will keep going until we accomplish that, and then keep going after that. I want to thank you all who've helped us get here. I love you all. It's been my honor to be on this journey and for us to keep going, because this is just the beginning. Sending my love, respect, and admiration. Signing off.